All right, to continue our very educational afternoon, up next, we turn to the perspective of an academic institution known for producing and training outstanding medical professionals. But while they're setting up, I would like to remind everyone again, if you haven't already done it, please scan the QR codes that are posted all around the room. They're here on the walls, they're right behind you, here on your left and on your right. And please answer the short survey, and this will serve as your raffle entry for later on, where you can win some exciting prizes from our partners. And I'd like to acknowledge them right now. The prizes later are courtesy of our brand partners featured today. Watson's gift boxes worth up to 1,000 pesos. The Medical City grocery packages. AC Health gift certificates up to 5,000 pesos off. TGP care packages, and MaxiCare health card. Once again, Watson's gift boxes worth up to 1,000 pesos, the Medical City grocery packages, AC Health gift certificates up to 5,000 pesos off, TGP care packages, and MaxiCare health cards. The winners will be announced after the program, so stay tuned and make sure you stay till the end. All right? So next, everyone, to talk about producing and training outstanding medical professionals, let us all welcome the Chief Dietitian of UST Hospital, Dr. Maureen Sarmago.
Thank you. So good afternoon, everyone. Are we still awake? Gising pa. Baka may nagpo-food coma na sa inyo. Are you familiar with food coma? Di ba? After we eat, you kind of feel sleepy. Wala rin naantok? Dapat wala. Okay, so my topic for this afternoon is our, of course, the UST Hospital programs and initiatives to promote proper nutrition and sustainability. Okay? Next, please. Ayan. So, what happened to my slide? So, okay, let me start my lecture, my talk with iconic quote. Alam na, nutrition students, you know this, right? Let food be thy medicine and medicine be thy food, which you know is from whom? Andiyan na rin naman, Hippocrates, right? The father of medicine. I'm sure this, for nutrition students and dietitians here, this resonates to us, right? Kasi it kind of reminds us of what? That we have what? That yung every diet plan that we make, diba, that we create, or every meal we prepare, can contribute to the healing of our patients, right? Or overall wellness, no? Importante. And really, we have a role, no? It also reminds us that we have a role in addressing the nutrition-related problems of our time. Meron ba tayong problema ngayon sa Philippines in terms of nutrition? Yes, no? But since I'm from the hospital, I will start with this issue first, no? Okay, malnutrition in hospitalized patients. We know that mataas siyang rate na yan. Just 50 to 70% of all our admitted patients could be malnourished or at least of malnutrition. So we know, may consequence yan if they are malnourished, that could actually lead to what? Increase in their infection rates, right? And they can have what? Reduced or delayed treatments, and of course for them, longer hospital stays, and also higher hospital costs. Do you agree? Agree naman tayo, no? So with that, of course, with us, from the dietary department or as dietitians, we want to address this concern. So next, please. And we have actually initiated the following. We have adopted, I don't know if you're familiar with this, the Department of Health Administrative Order, which is on the guidelines on the implementation of nutrition care process in hospitals, in both private and government hospital. Now with this guideline actually, with this directive, now it makes it easier for us dietitians, in identifying the problems of our patients. Because with this directive, saan yung mga nurses natin dito? Nurses, future nurses, yes, kayo. Nakita ko kayo, So, with this guideline pagdating niyo sa pag nag-work na tayo sa hospital, you are now in charge of doing the nutrition screening of our patients, all patients upon admission. Now with that, siyempre lahat na na-screen natin that are at risk of malnutrition should be referred to us by our doctors so that we can again come up with a sound nutrition care plan for them. So again with this, actually sa totoo lang, it's not yet 100% or perfect yung ating implementation, but at least nakastart na tayo with this directive. Okay? Next. Ayan. So, take note that again, to address malnutrition, we make sure that we provide our patients with individualized or personalized nutrition management. When I say individualized, right, there's no one-size-fits-all management. Okay? Every patient is different. Okay? We have to consider the nutritional status, ano ba? Diagnosis, of course, medical condition, their food preferences, their cultural beliefs. All of that should be considered. And then, of course, we should base our management with what? Updated guidelines, right? And also with evidence-based. Lagi kang ganito, evidence-based recommendations. Where do we get our recommendations? Of course, it should be from our credible medical and academic organizations, such as what's seen here. So hindi lang basta sana isipin lang natin. We have to have evidence, of course. Next. Ayan, so UST Hospitals actually believes in the strength of collaboration, para we could provide comprehensive, and holistic care. We actually work hand in hand with the different health professionals, with the doctors, or nurses ulit, We always collaborate with the medtechs, of course, pharmacists, lahat yan, to be able to come up with the best patient care, Ayan. And next, we also give them ito. There's a saying that no food is nutritious unless consumed. Agree? Diba? Like we dietitians may come up with parang napakagandang diet plan, meal, diba? Parang hindi naman kinain ng patient natin. So hindi siya nutritious. Walang nangyari, right? So again, we consider that. We always make sure also, we try talaga to come up with safe, nourishing, appetizing meals. But there's always a challenge with this. Alam niyo kung bakit? Pag sinabi kasing hospital food, na-judge na siya. Diba? Anong ating tingin sa hospital food? Hindi talaga masarap. Hospital na ba kayo? Try nyo sa amin, masarap. Okay, joke lang. Okay. Of course, alam nyo, that is really a challenge, Kaya nga, kami din, but take note, sabi nga kanina, when there's low salt, di ba? So we're not used to low salt diet. So some really complain na hindi masarap. But again, that depends on their specific diet. But still, we're making effort pa rin to improve this one, Actually, last time, we have collaboration with CTHM. Nasaan yung mga taga-CTHM dito? Wala na. Ayan, Actually, we invited the chefs from CTHM to have training with us, to train our people, to improve our meals and our meal presentation. Okay? Ayan. So next, of course, to empower our patients on how they can manage their condition. We provide them personalized and practical, going back, please, pakibalik po. Ayan, nutrition advice, diba? So we know this, sa mga nutrition students, we always ask them, what's the goal? Diba? Pareho tayo ng goal with our patients. So again, we need to provide them, diba? Na sila mismo makapag-manage they have their meal plans, diba? And also the relatives, to be part of the counseling para sila lang sa pagdating nila sa bahay din also manage their condition. And next, we also have this, we conduct, we believe, like kanina sinasabi lagi, preventive healthcare, And again, we also have this program in our hospital. We conduct nutrition seminars for our outpatients. And anong mga focus natin dito? Of course, kasama naman about management of conditions. No? Right now, we have memorandum of understanding with CKD or chronic disease clinic, no, of our hospital. So kasama kami sa management ng mga patients nila. Same with, we also have now collaborations with BCI, no? So we have dietitians there attending the meetings, no, regarding treatments of our patients, no. So kasama yan. You see, it's again collaborative. So, and we also have partners with Department of Pediatrics of the hospital. So dietitians, no, ang dami nating trabaho actually, and marami tayong pwedeng gawin actually sa hospital. And so this one, we are focusing here, for example, on infant or child nutrition or maternal nutrition, no, to again teach our mothers or how to feed their kids. And this one, ito may mga lecture din kami with CKD patients. Okay? All of these efforts are actually centered on providing, of course, the best, no, patient care. We believe that next, efficiency in patient care with our collaborations, different health professionals, we can provide the best care to our patients. Meaning, gagaling sila agad, tama ba? Hindi na paulit-ulit yung mga blood test nila, We can diagnose already the problem right away. And I believe, no, that actually can lead to sustainability. Okay, that can reduce, again, resource waste and also optimize energy, water, and materials in healthcare facilities. Do you agree with that? Ang UST known for a high-quality patient care. Sana agree ba tayo dito? Hoy, Tomasians tayo. Wala nag-agree sa akin. Are you still awake? Gising pa ba tayo? Okay. So aside from this, of course, initiative, we also are aware that aside from malnutrition in patients, in our admitted patients, we also have another issue that we address. Next, our country still suffers from the triple burden of malnutrition. Okay, so this is based on the Expanded National Nutrition Survey of 2023. And we can see, that we still have problems in terms of malnutrition among Filipino children and adolescents. 30% daw of Filipino children are stunted. Kasali kaya tayo natin dito? Hindi naman siguro, no? No, joke lang. Okay, so we still have 30%, and we still have 2 in every 10 children are actually underweight, and among adolescents, stunting is still there. Aside from that, next, please. Macronutrient deficiency. Okay, mostly now it's more on iron deficiency. Okay, and the most vulnerable groups for this one are, sino ba? We have our elderly, we also have children, yes, and also pregnant and lactating mothers. And sabi natin triple burden, what's next? What's next nutrition problem after micronutrient deficiency? Hi, mga nutrition students, triple burden. We have undernutrition, we have micronutrient deficiency, and lastly, ang galing ng mga nursing students dito. Babawi kayo ha, nutrition students. Ayun, di ba? Sige, sorry naman. Okay, this is quite alarming, no? Like they say that 3 in every 10 adults are overweight. And 1 out of 10 is obese. I-add nyo yan. 4. Di ba? 4 in every 10 adults are actually overweight and obese. Kung tayo ay 200 dito, so ilan kaya dito yung overweight and obese? Kung i-base natin with that 40%. So ilan yun? Of 200. Nahirapan din ako mag-compute. 200 0.4. 80. 80. Totoo kaya? Parang hindi naman siguro. Totoo ba? Okay. But I also want to share this one. Next slide, please. Okay, kasi yung ginamit sa una would be, it's the WHO classification of BMI or body mass index. But if you will use Asia-Pacific criteria, what it's showing is it's not just 4. Okay? It's already 5 out of 10 or 50% of Filipinos could be classified as already overweight and obese. Parang ako, for me as a dietitian, it's really nakakatakot and alarming because we know, alam natin that obesity or being overweight and obese is one of the risk factors on the development of what? Chronic diseases, like non-communicable diseases. Okay? Parang sinasabi lang dito na ang dami natin magiging pasyente in the future. Do you agree? Yes. Parang wala nang sumasagot sa akin. Yung mga interns ko dyan, or are you? Ayun, gising pa sila. Okay. So next. So yun din ang next point ko dito. We have still, no? The trend, no, of non-communicable disease is actually increasing, right? Sa hospital na lang, di ba? Ang dami naming pasyenteng diabetic, with cancers, no, cardiovascular diseases. And based on this, according to WHO, 7 of the 10 leading causes actually of globally were actually non-communicable diseases. Okay. So tingin nyo, what's the impact on our healthcare with this one? Ano kaya ang impact niyan? Okay? So, sabi ko nga, no, ang daming magiging pasyente in the future. Okay, next. So, with that, in response to this, because we want now to focus, also focusing on preventive nutrition, okay, in the hospital. Okay, so we're coming up with programs, no, initiatives, of course, to promote ano nyo yun, healthy eating habits na lang. No? I'd like to mention natin yung previous speaker. No? Ang dami nasabi kanina, like promotion of healthy diets that are, we say healthy diets, alam natin yan, with increased consumption of fruits, vegetables, whole grains, nuts, and legumes, right? And lower consumption of, can I hear some of the nutrition students here? Huh? Fast foods daw because they are high in, nagturo na ako. They are also because of saturated fats, trans fats, sodium, cholesterol, right? And also, of course, ito kasi hindi pa masyadong na-focus, but yung sugar, no, intake of sugar, that's too much among kayo, sa mga estudyante now. And then we know that can also increases the risk for many conditions, no? Ayun. And also, our programs also focuses on weight management, okay? Achieving, of course, ideal body weight, desirable body weight. And ito, kasama namin lagi sa programs namin with our personnel, our employees are the PTs. O, sino mga taga-PT, mga PT dito? O, pagpunta niyo sa hospital, gigisingin ko kayo. Actually, no, you also have a role in preventive healthcare. Kasi, di ba, you have to emphasize the importance of being active or, di ba, being physically active kasi kailangan pa rin yan. Okay? So, we have these programs, no? Una muna sa empleyado. Bakit empleyado din? Okay? Because we believe that we have a strong and healthy workforce, personnel, di ba? That also equates to a strong, no, foundation of a strong workforce that can provide high-quality patient care. So yun yung talagang finopokus. So our administration is very supportive with these projects. So aside from the seminars, and mind nyo pala, hindi lang kami to, ha? We have collaborations again with the Human Resource Department of our hospital. We have the Apolinario Mabini Rehabilitation Center, and also the different services, no, family med, cardiology. So again, nephrology and others pa, no. And next, ayan, so last April, the first week of April is Health Workers Week. And pinasok rin namin ang nutrition, of course, no? We tried to again recognize our personnel by having projects focus on, again, healthy eating, no? We provided them healthy breakfast, kasi breakfast is, ano si breakfast? The most important meal of the day, and also we provided them snacks, no? Healthy snacks pa rin, syempre, no? And try to give them healthy gift packs, yan. Mayroon din kaming fruits from our management, no? Diba? Nutrition pa rin. Sabi nga, an apple a day keeps the doctor away. So yung mga ganung nutrition messages namin, okay? Ayan. So next, Ayan, so this one, we also have this Olympics. We partner with when the hospitals having their sports fest, we partner with them, no? We have our Olympics. So in Olympics, parang mga lang to parlor games, but focusing pa rin on how can we create awareness on healthy food choices. And mind nyo, alam mga snacks namin ditong binibigay. Na-mention kasi ni Ma'am kanina, like we give boiled saba, boiled corn, nuts. Yun yung mga pinaprovide namin snacks during this event. Again, we are teaching them healthier food choices. Okay? And of course, the importance of physical activity. Okay? Another program that we had, of course, this one, hindi na to pang empleyado. It is open to the USTH community or UST community as a whole. Even patients and their relatives, we allow them to join our activity. Nutri Fiesta is our yearly celebration, parang pang kick-off namin for Nutrition Month celebration. And this, during this event, we actually conduct pre-nutritional assessment and nutrition advice. And we give them also, may mga pag-games din kami dito, kaya nga fiesta. Our games, fun, engaging games, still focusing on nutrition. Okay? Ayan. Kasi para mag-join sila. Tama ba? We have to, as dietitians, kasi we have to come up, para ba magiging creative way, to put, para mag-spark ng interest on good nutrition. Same with this one, Nourish to Flourish naman sa activity, we had, as a start of, a celebration pa rin of our USTH anniversary. Same lang, we have bone scan here, we have nutrition assessment, diet advice, and again, engaging games for our community. Next. Ayan. Kasi di ba, we keep on teaching them na ito yung healthy, but again, hindi naman siya readily available. So, we actually had this project to, again, promote also consumption of fruits, vegetables, healthy fruits and vegetables pa rin yan. Okay? Pag ako, whenever I ask people, like mag-lecture ako, what comes to mind with nutrition? When you hear the word nutrition, most of the time they say fruits and vegetables. So there's already that, di ba, awareness or knowledge na talagang healthy sila, okay? Kaya when you ask them, meron ka bang intake ngayon ng fruits or veg? The answer is, wala. Wala naman, okay? Kayo din ba? Yung mga taga-PT dyan, sino sa inyo nakakain ng fruit today? Meron ng fruit intake for the day? Meron na ba? Wala. O sige, sa nursing, any fruit lang. O may isa. So, anong kinain? Banan. Mango. Very good. Nutrition students. Dapat, di ba? Ayan. So, that's the purpose of this activity. We make it available for them. Napansin namin yan. We also have this, during our Nourish to Flourish activity, meron kaming pa-free food. Bipili ka ng price mo between bread and fruit cups. I was expecting that they will choose the bread. But no. Actually, naubos na kinuha lang na yung bread, yung ubula na yung fruit cups. Okay, so I guess it's the availability that's one of the concern. Kaya hindi tayo kumakain ng fruits and veg. So that's the purpose of this activity. Next. Okay, so of course we also provide this one. So our indigent patients, we provided them pre-nutrition counseling. Again, focusing pa rin on healthy eating, of course, that can reduce, of course, the risk of chronic diseases and others. Ayan, so next. Ato, I don't know, we have a page, our department, the USTH Nutrition and Dietetics Department, and we have this social media posting, of course, focusing pa rin on nutrition. Actually, ito, ginagamit namin ito yung mga gawain ng mga students namin, okay, ng mga interns namin. Okay, for example, sorry, hindi malinaw, but again, different nutrition messages, practical nutrition messages that you can apply, Ayan. So with that, ayan. So we believe, with preventive nutrition, it can promote sustainability. It can contribute to sustainability because Diba? It can reduce the burden on healthcare systems. It can minimize the environmental and economic cost of managing advanced diseases. Nandun tayo sa paulit-ulit kanina. Prevention is better than cure. No? Hindi tayo lang sa hospital para cure lang, no? But no, we can also promote, diba, prevention. Ayan. So, I also included here, next please, some sustainable practices, no, that we try to do in our department. We're starting with this one. Of course, promotion of plant-based diets. Na-mention na ni the previous speaker actually, na nag-explain na maayos, no, maganda, no? How can plant-based diets promote planetary health? And slowly, actually, alam naman natin that it's actually good, right? And being, di ba, sabi natin, lower in sat fat, di ba? Walang cholesterol, ayan, no? And higher in fiber, higher in antioxidants, phytochemicals, and all. So it's important. Actually, it has a role in managing or preventing a lot of conditions, no? But, actually, isipin din natin, with pinggang Pinoy, tama ba? Pwede na siya, di ba? Plant-based diet na rin siya. We just have to focus on telling our patients that they should have whole grains. Tama? Hindi mga white bread, okay? So yung mga corn, ganyan, no? So as part of their pinggang Pinoy, so kasi pag titignan mo naman ang pinggang Pinoy, only if you know, sige nga, I'll check nga if they still know their pinggang Pinoy. How many % of the pinggang Pinoy is parang per protein? Allotted per protein. 25 ba? Are you sure? Hindi, it's not 25. It's only 17%. Kasi half of the plate should be fruits and veg, 33% should be your whole grains, right? And then 17% for your meat, fish, no? Ayan. Or now, we can also use, di ba, nuts and legumes and seeds, right? Ayan. Okay? So with that, also have nutrition telehealth. Now, we also providing now online diet consultation, no? At least, di ba, sabi nga, hindi na sila pumunta sa hospital, so yung gas emissions would be lesser for those patients, di ba? Ng mga pasyente natin na yun. And also try to work on our food waste reduction by making sure that, syempre, yung tamang preparation, and we monitor the tamang portion control, no? We monitor the plate wastage, no? Actually, totoo lang, before we give 1 cup of rice, and now we're just giving 3/4 cup. Kasi nakita namin, hindi naman nila kayang ubusin yung 1 cup of rice. Okay, that's one. And also, we are, syempre, bulk cooking to lessen the energy costs, no? And we are now investing. Our management is very supportive with this one. We are now investing on equipments that are actually energy saving or can lower the usage of water and energy. Ayon. So, again, the hospital is very much, of course, supports the vision of sustainable healthcare. That's why we have these programs, no? Again, we are focusing on providing pa rin excellent healthcare, patient care, and preventive nutrition. Ayan. And also this mga initiatives, no? We still have a lot of things to work on. We know that, no? Like, if some of you have been hospitalized, no, sa USTH, we're still using actually disposable, wares. Medyo may mga, pa tayo, no? Hindi pa talaga siya wares, so hindi pa sila environmentally friendly, but we're working on that already. Ayan. And also, we believe also, no, we have excellent training. I don't know if my trainings will agree with this, no? I believe that also, di ba, if you have, magagaling, or, ito na yun ito na papasok ang ating UST values. If we have competent, committed, and compassionate, tama ba ako? Healthcare workers in the future, syempre kayo, no? That also can, again, that would contribute to sustainability because we can provide the best patient care to our patients. Okay, so let me end my talk with another quote, but this one is by Mahatma Gandhi. So sabi dito, the future depends on what we do at the present. So marami siyang pwedeng pasukan, right? So sabi nga kanina, if you, kayo, be healthy, may mga message kanina that you should be healthy, tama? Take care of our health, let's start now. And we try to, again, also focusing on sustainability, kung ano pwede nating gawin to, again, to take care of the environment. So we should start siguro now at present, no? So again, that's all. Thank you all for your kind attention. Okay.
Thank you very much. Thank you very much, Dr. Maureen Sarmago. It's really nice to hear that we have a lot of preventative measures, right? Very good. Thank you very much, Doctor. Let's give her another round of applause, everyone. Thank you so much for that.